get back out there, go back to work, go out to eat, go shopping, but it's going to be different. We have to change the way we do things, and this is a great example of that. We're trying to be flexible, allow for things to get somewhat back to normal, but with a new set of rules. I want to give a special thank you to Margie O'Brien and Capital TV. Margie's not here today. We're going to go back to the more traditional way of reporters asking their questions. Margie didn't get a single day off. She got off Easter and Mother's Day. So thank you, Margie, for chipping in and being so fantastic for the past 8 weeks. So as you can see from the data reported on the screen, it's a good news story with this data. It's a continued plateau and a continued actually decline in new hospitalizations. We have 176 new cases, and very, very sadly and unfortunately, another 8 deaths. As I've said before, reopening the economy doesn't mean the virus is going to go away. The virus is here to stay for probably about a year until we have a vaccine or a very reliable therapy. However, we've learned how to deal with it. And as you can see here, everybody wearing face coverings, social distancing, hand washing, staying at home if you're sick. These are all the things that are going to keep us safe while we go ahead and start to reemerge, leave our homes, and go back to work. I will say that I lifted the stay-at-home order on Saturday, and I'm very pleased to report that, only 2 days into it, things are so far going very smoothly. Mother Nature probably helped us out over the weekend. It wasn't the warmest weekend, so we did not see everybody rushing out. We didn't see a lot of large group gatherings outside, even though the parks have been reopened. We had many inspectors out visiting hundreds of local businesses, and we noticed 95% of employees were wearing face coverings, so that was terrific. Thank you to all the retailers and employees. Unfortunately, customers were closer to about 75%. So we do need to do better than that. If you want to go out shopping, and I hope you do, because our local retailers need a hand, they need the business, you do need to wear your face mask. If you want to go out shopping, 75% isn't where we want to be. Retailers need a hand. Everybody, our focus here is voluntary compliance. It's very easy to wear a face mask. Just wear a scarf. Any cloth covering that covers your nose and your mouth is very important. We also continue to see very mediocre compliance of people with their masks on at drive-thrus. If you go through a drive-thru, pick up your food, pick up your coffee, you are within 6 feet of the cashier at the drive-thru. So please, even though you're alone in your car, for that moment in time that you're paying or getting your food at a drive-thru, I'd ask you that you please put on a face mask or a cloth covering, frankly, out of kindness and courtesy for the hardworking person at the drive-thru. Okay, so I want to take a few minutes to talk about reopening. I want to begin again by thanking the people of Rhode Island, thanking businesses, thanking everybody for their cooperation. 7 weeks ago, when we were looking at our models of where we were and where we were going, if we stayed on the trajectory we were on at that point in time, we were looking at 8,000 or 9,000 hospitalizations and more than 4,000 deaths. The picture today is very, very different than that, thank God. Much, much, much lower experience of fatalities, sickness, and hospitalizations. And that's because Rhode Island stepped into action, obeyed the stay-at-home order, closed down businesses as hard as that was. And now Rhode Island's in a better place. Furthermore, you've given us the time we've needed to get our systems ready to handle increased cases should that happen when we start to reopen the economy. And, contact tracing, testing, hospitals, extra staff, PPE, ventilators, and the like. So because we've really flattened the curve, because we've built up our system and had the infrastructure in place to take care of folks, Now we're in a very good position where we can start to slowly reopen our economy, slowly start to go, back to work, back to shopping, and feel confident about that. And I do think that's important. I want you to feel confident that when we open retailers, as long as you're following the new rules, it's okay for you to get out there and go do your shopping. It's very important, though, that we go slow and we be cautious. Slowness and cautiousness. And particularly for older folks or folks with underlying health conditions, you have to be especially cautious. That now we know so much more about this disease than we did 2 months ago. And the thing that is certain is that this disease is toughest on the oldest among us, the most frail among us, and the sickest among us. So if you're in those categories, you have to be extra vigilant to take care of yourself and follow the rules. I would say also, tension is running high. Lots of people have been out of work for a long time. Restaurants and shops have been closed. We've all been cooped up in our house for weeks. Our kids, I see it in my own kids, they miss their friends, they miss the routine of school. So the inclination can be to get frustrated, lose patience, get angry. You see a protest, just today, people are frustrated. So I'm going to ask you again to be kind, to be patient, to keep yourselves informed, and focus on facts and not frenzy. I only want to reopen this economy once. I don't want this to be fits and starts. Reopen, see a spike, close. Let's not do that. Let's go slowly, walk before we run, take this in phases so that we can never take a step back. And later this week, I'll be giving detail on how we think about moving from phase 1 to phase 2, and also how we think about when we might have to go back a step, which I hope doesn't happen. So what I would say to you is be cautious, go slow, be kind, be patient, and continue to look on friends, family, and neighbors. People are under an enormous amount of stress. If you can do anything to be kind, to be patient, to look in on a loved one, to bring somebody food, to take care of the elderly, please, I'm going to ask you to keep doing that. And also realize everything's going to be different. This is different. This press conference is different. When you start to go out for dinner, it's going to be different. When you go back into your office, it's going to be different. And my best advice on that is don't try to fight this. This virus is here. It is powerful. We don't have a cure. We don't have a vaccine. So don't fight it. Be creative, flexible, collaborative, and let's look to adapt our way of doing things so that we can live safely with the virus. But we can't try to outrun it because we know that won't work. So I want to take a second to talk about restaurants. We have many, many restaurants. Many are just closed. They haven't been able to figure out a way to make it work with takeout and delivery. Those are doing takeout and delivery. They're operating at a fraction of the business that they used to do. And so it's a top priority of mine to do all that we can to help this industry. Like everything else, it won't be a flick of the switch. Having said that, I'm very pleased to say that we worked throughout the weekend to figure out a way so that we can allow restaurants to reopen outdoor dining only 1 week from today, May 18th. So over this past weekend, we had our first 2 days of retail openings under a new set of guidelines, and that went very well by all accounts. We don't know exactly how many shops opened, but we know there were many, many that opened, and we know that people were going out, and we know there were no major problems. So that gives me confidence to do a little bit more. So as of May 18th, restaurants will be able to begin limited outdoor dining in addition to takeout, delivery, and drive-through operations that they already currently have. Now, tonight, by this evening, there will be details on what the new guidelines will be for outdoor dining at our website, reopeningri.com. But I want to give you a flavor of what the new guidelines will be. I want to do that mostly for the public. Restaurant owners, go to reopeningri.com tonight. You can get all the details. Also, I want to give a huge shout out to Commerce Secretary Stephen Pryor, who's been in touch with literally hundreds of individual restaurants, plus the Hospitality Association, to seek their feedback. And you can go online tonight to get the details. But for the individual Rhode Islander who might be saying, oh, I'd like to go out for dinner next Monday night, what's it going to look like? Here's what it's going to look like. Dining will be reservation. So at least initially, you won't be able to just show up spontaneously. Your dining cannot exceed 5 people, and that's in accordance with the existing social gathering of 5 rule. Tables in the restaurant will be spaced at least 8 feet apart, or if not, will be separated by barriers. And there'll be no more than 20 tables in total in any particular outdoor space. Menus will be different. It's not going to be the traditional menu that you and then the next table can use. We are recommending one-time use paper menus or digital menus or a chalkboard menu or no menu at all. Maybe just that your server will tell you what's on the menu. Condiments and utensils will either have to be single use or sanitized between uses. All high traffic areas will have to be frequently cleaned. Tables and chairs will be sanitized in between parties. Self-services food stations like salad bars, buffets, bar type settings for eating will all be prohibited. Cashless and contactless payment methods will be encouraged. Pens and payment stations will be frequently cleaned. And for the moment, no valet services will be allowed. So customers will be asked to park their own cars. In addition, and I cannot emphasize this enough, please do not go dining if you feel sick. Actually, you shouldn't be leaving your house at this point in time if you feel sick. If you have a fever, aches and pains, a cough, a sore throat, the sniffles, you should not be going to a restaurant. Don't make the reservation. You shouldn't be going to work. You really should be staying home. This is important because it's different. All businesses, including restaurants and retailers, will have to screen customers for symptoms before they come into the restaurant, asking you, do you have any symptoms? Now, we are not requiring a particular kind of on-site screening. We're not saying it has to be a particular kind. It could include hanging a poster, asking customers to self-screen. It could include the hostess asking you. It could include a temperature check. That's up to the restaurant, but we don't want anyone who feels sick to be in a restaurant. When you make a reservation at a restaurant, you'll be reminded that you will have to be screened for symptoms when you go to the restaurant. And customers making the reservation will also have to provide their contact information for potential contact tracing purposes. In the event that somebody, why is this? Because in the event that somebody tests positive after being at a particular restaurant, the Department of Health will be able to obtain a list of those who have had a reservation there and could have come in contact with that affected person. So this is going to be one more tool to do effective contact tracing. So when you call, again, this is different. You can go out for dinner starting May 18th, outdoors. You have to call for reservation. You have to give your name and contact information. You will be reminded that you can't go if you're sick. And then when you show up for dinner, they'll ask you, are you feeling sick? And all of that will be tonight on a website. Furthermore, we're working with municipalities to create a streamlined process for the approval of outdoor dining and liquor sales. We have heard from a lot of restaurateurs Essentially, they are asking not to have to go through a lot of red tape in order to enable the outdoor dining. It's a very fair ask. Department of Business Regulation has already been working with the League of Cities and Towns, municipal leaders, and mayors. We are coming up with new ways for it to be very fast and streamlined so you can have whatever necessary permits and approvals you need in order to enable outdoor dining in different and new creative ways and liquor sales. And so DBR, by the way, DBR has been doing a terrific job through all of this, and they have some really creative ideas about how we can quickly enable restaurants to get up and running with outdoor dining. So it's my hope that in the next few days, I'll have more to say about assisting small businesses, including retailers and restaurants as they reopen. We're hearing from a lot of restaurants asking, how will we help potentially with cleaning supplies and PPE and instructions? So we're working really hard to make it so that perhaps we could provide, say, one-time access to free and reasonably priced supplies to help out our restaurants as they begin the process of reopening. I don't have a specific announcement on that today, but it's my hope and intention that to give a hand to restaurants who are going to have more cleaning supplies and such, we're going to be able to help you out. So stay tuned on that. Finally, and related to that last comment, I'm hearing a lot from small businesses, restaurants, retailers, hospitality, really a lot of the small businesses that have been most affected by this crisis are asking, will we be able to provide some emergency relief? And they've noted that in other states, other governors have done this through the use of the COVID Emergency Relief Fund. And the answer is yes, and we're working very hard and as fast as we can on that. Again, I hope to be out within a week or so with some specific information about how we can help you. I realize that you are struggling. I realize that reopening is coming with additional expenses. Could be plexiglass, could be signage, could be new menus, could be cleaning supplies. And so we definitely intend to use some of the COVID relief stimulus money to give a hand to our small businesses. And I'd ask you for just a little bit more time to put the details out around that. Additionally, as of later today, there's going to be a place on the reopeningri.com website to ask you for your feedback on how we could most effectively use stimulus funds to help your small businesses in the here and now. There's a lot of examples out there from other states that we're looking at. I was on a call earlier today with the White House and other governors, got some good ideas. Stefan's been working hard, but I want to hear from you too. If you're out there and you're struggling, if you're self-employed, if you're a small business, the best way we can help you is if you tell us exactly what your needs are. So later today, reopeningri.com, there'll be a place for you to send us your specific feedback on how we can best use the stimulus monies to help you, and I hope you take a minute to give us your ideas. So with that, I'm going to turn it over to Dr. Nicole and come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. To the reporters in attendance, I also want to thank you for your flexibility and patience, creativity, as we've worked to find a way to give you a chance to ask questions while also making sure that we're following public health guidance. So we appreciate that model. I'll start with our data update for today. We have 176 new cases to report. There are 276 people currently hospitalized. Of those people, 73 are currently in the intensive care unit and 52 are currently on a ventilator. We sadly have 8 additional COVID-19 associated fatalities to report, as the governor shared. These people range in their age from 60s to 90s. 3 people were in their 60s, 2 people were in their 70s, 2 were in their 80s, and one person was in their 90s. Our deepest sympathies are with the families of those dear Rhode Islanders who we have lost. I want to follow up briefly on what the governor discussed about restaurants. What we have developed across state government, Rhode Island Department of Health, Department of Business Regulation, Commerce, as a team, on behalf of the governor, is a very thoughtful, measured, public health focused approach for restaurants. What underlies our guidance for restaurants and for people who will be eating outdoors at restaurants are the same infection control principles that have been guiding us through this since day one. The governor has shared that we want people to use menus differently, disposable menus, menus that are sanitized between uses. That's because menus are a classic high-touch item that gives us the opportunity to handle it differently. Similarly, reusable condiment containers are also prime example of high-touch objects that members of the public will use at different times. And that's why our guidance stipulates that restaurants should be using single-serving containers for condiments. We want workers spaced out and diners spaced out to minimize the chance that respiratory droplets spread between people. This is also why we want people wearing masks where appropriate outside of restaurant situations, and we'll be exploring how we will apply that here. Another way we are going to be asking food establishments to partner with us is by asking them to retain employee logs and the names of customers for at least 30 days. Only reservations will be accepted. There will be no walk-in service, as the governor has shared. This is so we can respond quickly and effectively to any outbreaks that occur. Rhode Islanders have been doing a good job, and we are confident that you're going to continue doing a good job. You should be confident going out and going to restaurants for outdoor dining as well as going to shops. We want you to be confident, but also not complacent. Wear your masks. Use hand sanitizer and wash your hands frequently throughout the day. Stay in small groups. And most importantly, stay home if you are sick. On this same theme of being confident but not complacent, I wanted to relay one last thought, this one about testing. More and more people are getting tested every day. We are getting close to having tested 100,000 people in Rhode Island. This is a tremendous feat, given that we are standing here just 71 days after our first case identified by the state health laboratories of the Rhode Island Department of Health. If you are a Rhode Islander who got a negative test result in the last few days or who gets one in the few days to come, there are some things we want everyone to keep in mind that aligns with the message that we have been saying. A test is a one point in time test. Particularly if someone does not have symptoms, the reliability of the results is not as good. So just because someone has tested negative, that does not mean that they will remain negative for time to come, because the test is just one point in time. If you've been told to quarantine because you had direct sustained contact with a person with COVID-19, even if the test result returns negative, it's important to remain in quarantine. If you receive the negative test results, but have symptoms of some kind, you still need to remain in isolation and continue to recover safely at home. That means even doing whatever you can to be in a separate space from the people in your own household. As the governor has said, and I have said, we are moving in the right direction, but we are not out of the woods yet. Each of these steps we are talking about taking cautiously and safely matters. We all need to continue to think about how decisions as individuals impact Rhode Island as a whole. And with that, we will get started with questions.
Governor, with the restaurants reopening and you keeping a contact log of customers, will a restaurant have to close if they find out a customer came in who is sick? Or what's the protocol if they have a sick staffer or a sick customer come in?
So that's not currently what we're thinking. What we're thinking is that they would reach out to the other people that were there that evening and then continue do a contact tracing initiative. If it's a employee who is sick, then we would treat that like any other place of work, which is to say everyone who is around them should get tested, all the other employees, and that sick employee would have to obviously isolate. But no, the hope is, and so right now, what we're very focused on is figuring out how to deal with outbreaks. And again, I was on a call earlier with the governors. You're seeing outbreaks all over the country, meat processing plants, factories, we've seen it here, nursing homes, the veterans home, a couple of manufacturers. So our goal is if there's an outbreak to have everybody tested within a day or less, everybody quarantined as necessary, and then all the contact tracing done. We don't want to be in the business of having to close down any businesses really again from this point forward.
You guys know about the virus, and I guess I would ask all three of you, do you plan to go to restaurants on May 18th?
I do. I don't know if I'll be able to get out on May 18th exactly, but I feel confident enough to do it, and I'm gonna do it, lead by example, and encourage other people to do it too.
The two of you?
Yes, looking forward to it. Will this contact tracing method be used in any other businesses besides restaurants, grocery stores, or anything like that?
Okay, that's a great question. We hope that every business encourages their employees to engage with our contact tracing. And later this week or next week, when we roll out the one-stop app, we're going to be encouraging every single Rhode Islander to use it. We can't force anyone. We're not going to force anyone. All of this will always be opt-in. But over the weekend, Stefan and I had a call with a lot of business owners, showing them what we're thinking of in terms of the Contact Tracing Act and encouraging them to encourage their employees to use it. It's only as good as a lot of us using it. Like if 10% of Rhode Island's population opts in, this won't be effective. So yes, we're going to be encouraging everyone to do the same thing.
I got a question this morning from a viewer named Mike about youth sports. And he said a lot of families are struggling to figure out, there's costs for travel and things, and when even could youth sports begin? How long should they assume they are off? I realize there's a lot unknown, but can you speak to that a little bit for families wondering, or Dr. Nicole?
I'll go first and then we'll turn it over to Nicole. I'm hoping that Thursday or Friday this week, I'm going to have something to say about summer camps. If not, maybe next Monday or Tuesday. We want to be enabling as much summer camp and sports as possible this summer under a new set of rules. And, at the moment, that's pretty much what we have to say.
Regarding youth sports, the Centers for Disease Control and Prevention has just issued guidance for all of public health on the approach that we will be taking. So similar to how we have done it with the additional guidance that occurs, we'll align that with what works well for Rhode Island and make sure that we have a safe approach for going forward.
What's the high level guidance from CDC on youth sports?
The high level is it is challenging to maintain the distance that's needed within a sports environment. So we will need to look into what creative ways may be possible for the activity, the physical activity, to still be engaged. goals?
Yeah, for instance, everyone's already allowed to golf, so if it's a youth sport that's golfing or swimming or tennis, that's very different than, lacrosse or football, something else that's a real contact sport. So my goal is to enable as much summer camp and youth sports as possible in, following the doctor's rules around what we're allowed to do.
You mentioned the go ahead, John.
Governor, in your opening remarks, you talked about parks. You mentioned them. I know a lot of parks remain closed. What is your plan in terms of opening those?
Yeah, so we opened a lot of parks over the weekend, and we had a great weekend. We saw no instances of congregations over the weekend. Having said that, it was not great weather. So phase one will probably last a couple of weeks, and if it goes well, then I'd like to open more parks. We're also working on, we'd like to open the beaches, probably not before Memorial Day, but the goal would be try for these next couple of weeks with a handful of state parks. If it goes well, open the rest of state parks. If it goes well, let's get the beaches back open for the summer.
Coordinating that with the cities and towns, because some of these parks, for example, Rocky Point and Warwick or Goddard Park, are also, used as sort of municipal parks.
Yeah. So we are. So Goddard Park's a state park. If it's a state park, Janet Coit is working with us to reopen them. Having said that, we're working really hard with municipalities, and it would be my hope that they would follow our lead and we would all do the same thing at the same time. Having said that, at the end of the day, it's up to the mayor to do what he or she feels is right for their city.
Governor, will anyone be checking in on these restaurants to make sure that they're doing contact tracing and screening at the door?
Yes. So we have established a team of inspectors which is a team, people from DBR and Department of Health, to do inspections of all businesses to make sure they're complying with the new COVID regulations, including restaurants. So there will be enhanced inspections. Like this past weekend, I think we inspected a couple hundred retailers, and we will continue to do that. So every day, every weekend, as restaurants open, we'll be out with inspectors, really with the goal of helping them comply, not with the goal of punishing them. And what was the second question?
That was it, you heard it.
Okay.
If you're allowing 5 people at a table in a restaurant, does that mean the overall gathering limit is going to increase next week as well from the current 5, if there are people in that close proximity?
I don't know. I hope so, but I don't know.
Governor, with regard to the next federal stimulus package, the Washington Post reported that the White House had at least temporarily ended negotiations in Congress, and Politico reported that they're not expecting any movement on that for about 8 weeks. That's their best guess. Have you talked to the round congressional delegation on that subject, and what would be the effect on Rhode Island and its financial situation if the next stimulus is that far off?
Yeah, that would be devastating on Rhode Island, and I would suggest every other state. I talked to both Senator Reid and Congressman Cicilline over the weekend. I talked to our federal delegation almost every day. I will say this morning, we governors were on a briefing call with the White House, Secretary Mnuchin. That was not their representation. They represented to us as recently as 2 hours ago that, which is consistent with what our CODEL is saying, that negotiations are ongoing right now and that it's a matter of weeks, not months. So it is my strong position that Rhode Island absolutely needs an additional round of stimulus. The last round of stimulus we're not allowed to use for revenue shortfall. The Trump administration and Secretary Mnuchin and our CODEL have been crystal clear. That $1.25 billion is to meet the immediate needs of the crisis, whether they be economic or public health or PPE or nursing homes or hospitals. We are not allowed to use that to backfill our deficit, which is substantial. And so we 100% need, and I will fight for that additional stimulus. And from everything that I'm being told from the administration, from the Treasury Secretary, from our congressional delegation, they're hard at work negotiating that right now. And they're telling us it's weeks. They're telling us it's 3 weeks, not 8 weeks. Yeah.
Ronaldo,
It's a two-part question. First, what is the number for the Latino community? And second, why you allow an advertising agency to do outreach to the Latino community? And what is the budget? Because they're spending only a few $1,000s with the Latino station, and we are 45%. How do you want to reach the community with a few $1,000s spent in Latino stations?
Yeah. So listen, we are working overtime to communicate to the Latino community. This press conference has been 63 days in a row, translated in Spanish. It's much more than a few $1,000s. We've massively ramped up our testing in heavily Latino communities. I've done a lot of radio. My members of my staff do Facebook and radio every single day. I have twice weekly phone calls with a Latino advisory group that we have set up. So we can always do better. And it's my hope that tomorrow we'll do more to reach the community than today. But to suggest that it's just a small effort isn't true. We have doubled down on our efforts. In fact, just the other day, I was on the phone with Mayor Diosa, Mayor Alorza, trying to reach into the community. Right now, my top priority, I was saying to Brian, one priority is making sure we can deal with outbreaks. That I worry about that. There will be outbreaks. We need to get on them. We need to shut them down. I worry about the undocumented community. I worry about the Latino community. I worry about inner city communities where we're still seeing high percentages of positives, which hurts the community and frankly puts at risk the rest of the state. So if you have ideas of what more we can do, I will be wide open to it, but we are doing a lot.
Latino station. Don't give money to Latino Public Radio. Invest money with every Latino station. You're not doing that. You're using RTW to do a campaign that is not reaching the community. You need to do more. What is the number? 45%, 60%? Give us the real number for the Latino community and invest the money. You're spending millions of dollars building hospitals. Invest the money in the community. That's what you got to do.
Thank you for that. We do have a team that's focused, and we'll continue to get that input on how to go forward. To be able to share what the numbers are for race and ethnicity among cases, 44% of cases are among Latinos, 13% of cases are among African American, and 39% of cases are among Caucasians. That translates into our rates by cases, where 1,129 cases per 100,000 is among Latinos, 911 cases per 100,000 is among African Americans, and 220 cases per 100,000 is among Caucasians. So this continues to be a top priority, and we'll continue to take the feedback needed.
A couple weeks ago, you talked a little bit about the elderly potentially having different restrictions than everybody else. Is that still a thing that you're thinking? Are you going to actually roll something out?
Yeah. So I don't think that we've been spending a lot of time on this. It's a complicated issue. And as I've said so many times, we could never do anything that would appear to be in any way discriminatory. So I think we are not going to we're going to continue to prohibit visitors to nursing homes and assisted living. We're going to continue to encourage retailers and grocers to have accommodations for seniors. We're going to continue to and enhance our ability to strongly encourage employers to provide accommodations for their older employees, but it's not likely that we're going to have any official separate regulations.
we're getting even today on Twitter, again, people saying she's opening restaurants and we still can't go to church from people
Yeah.
who want to be able to have a service. Where's your head at right now on getting guidance out that allows some limited religious services?
Yeah, it's a really good question. We worked hard Friday, Saturday, yesterday with faith leaders of all denominations. So we've eased up a bit, which is to say that the 10-person rule for funerals and the 5-person rule for faith-based gatherings. We're going to, in the next couple of weeks, and by the way, that's consistent with the timeline that we're hearing from bishops and rabbis and faith leaders. They're saying that they want to go slow as well. And by the way, I don't blame them. I mean, there's a lot in churches are very large. They attract often an older population. There's hymnals and such where you share paper communion. We've had hours of discussion around how you safely distribute communion. So I miss church too. We're doing it like our pastor is streaming church and we sit as a family in front of our computer. It's a couple of weeks away. That's a long-winded way of saying it's a couple of weeks away. It's going to happen in the month of May. And we're just being cautious in light of everything that I said.
Take the red bandana and then Brian.
Who is that masked man?
It states to reason that as the state opens up, cases will increase. And if that happens, is there a level of increase that's considered tolerable considering moving to the next phase?
So again, later this week, it's exactly what we're studying right now. We are talking to our public health officials and epidemiologists, the CDC, Johns Hopkins, Rhode Island Hospital, like this is the question. And I'm going to have detailed answers later this week on how we think about it. So I'm just going to leave it at that for now, but I promise we'll be back with the details.
Dr. Alexander Scott, I just want to check, was the goal met to test everybody in nursing homes by today? And now where do things stand to start repeating tests for staff and residents? And is that making a difference, do you think, in the spread?
It's an excellent question. I need to get back to you on where we are with reaching that goal. We've stretched towards that. And we've already begun preparing for the cyclical repeat of testing. We know how critical that is. There are discussions on getting the supplies that we need to make that happen and already have the team in place to be able to implement it. So that's what we're moving forward with as a priority for testing.
Doctor, if I could follow up quickly on the question from Latino Public Radio earlier. You've been collecting race and ethnicity data for quite a long time now, several weeks anyway, as long as the crisis is present. And you have speculated, everybody speculated on why certain communities, Latino communities, the Black community are being disproportionately affected. But at this point, do we have enough data to make any data-driven inferences as to why those communities are particularly disproportionately affected and what specific actions can be done in response to those data-driven factors?
One of our most targeted data-driven response is to recognize that many of the people who are from the communities that are disproportionately impacted also comprise the critical infrastructure workforce, whether with manufacturing or with congregate settings or with retail and restaurants. So in partnership with Secretary, we have worked diligently to make sure that the guidance is clear for businesses as we go forward on how to make sure that their employees are safe. They have the masking requirements that are needed. They have the 6 feet distance that's needed. They have a representative who's able to engage directly with us on their COVID control plan and how to know the approach to contact tracing and getting the access to services needed to be able to quarantine and isolate. Critically, knowing about sick leave policies that are important to be able to support staff Those are some of the key elements that we have used our data to drive where we need to focus. And that's something we'll continue to move forward with.
We'll get the woman on this side and then Jill, and then we'll end for today.
Good afternoon, Doctor. My question is about some symptoms, and there's just a big variety with that, with asymptomatic people all the way up to, unfortunately, very severe people, and people have unfortunately passed away. Is there a reason scientifically or medically that describes that large contrast?
And contrast between?
It's symptoms. People are dying, the other people don't even have symptoms.
Yeah, it's something that we are still learning with COVID-19. As I've shared before, the wide variety of presentation from those without symptoms to those who require hospitalizations is something that adds to the challenge of our response, and we will need to continue to learn more about what sets certain people to be at risk more than others, beyond what we have been saying, which is age, older age, and underlying illnesses. Even within those populations, or those who are not within those populations, what sets someone up for a negative outcome or not. So we are still learning and assessing what we can learn from children, middle-aged, and older adults as well.
Question from Bill.
Doctor, any updates on translation and interpretation services at some of the new testing sites, the walk-up sites in Providence?
Yes, we have a robust effort now to really expand translation services, knowing the need for up to 10 languages being available. So the team that we have focused on this, our equity considerations team, that Courtney Hawkins, director of DHS, is doing a phenomenal job leading in partnership with our team and many others, our Health Equity Institute, engaging with community partners. All of that allows us to really focus the translation services on the languages that the populations who are most engaged will need. So we'll hope that you'll be able to see the outcomes of that in the days and weeks to come.
Thank you, everyone. We'll be back tomorrow.
Thank you.
Okay.